Okay, as you've seen in Module 3, this is all about leadership, ethics, and managing change. And in this first video, we're going to do a little example of leadership and change using a diabetes guideline that is being implemented or introduced in Hungary for physician health practices. And we're going to watch to see how each of these elements plays out as we work through this little exercise. We start by making the assumption that guidelines are not unfamiliar to practice staff, particularly doctors, but a new, more comprehensive set of guidelines is being implemented for management of diabetes. In fact, the Regional Health Authority has decided to audit practices of their clinical processes and outcomes based on the recommendations of the guidelines, in other words, best practice. The practice has an experienced nurse who is managing chronic patients for over 25 years. She's a good diagnostician. She has good sense about that, and a good rapport with patients, and working successfully with a community for a long time, with little need for supervision for most of the time. Thus, doesn't feel a need to follow those guidelines. How do you convince her to make a change in her practice? Does she have to change at all? And what is the balance between the guidelines and use personal judgment, and what works and what doesn't? This is a classic case of a change management process where you as the practice leader are going to play a critical role in helping implement this new clinical guideline. So first off, we're going to assume that there are no clear answers how to answer the question of how to create change. As a practice leader, you have the opportunity to begin the journey by change in the following ways. First off, you have the opportunity to establish what we will refer to as the context of the need for the clinical guideline. Secondly, you understand and try to accept that there's going to be resistance to this approach as a natural response to change, and your goal then is to optimize the benefits of the change while minimizing the threat implied by that change. That is, well, we don't trust the staff in doing good clinical work. We want to overcome that perception. Quality improvement is intended to do just that. Thirdly, we want to plan by incorporating realistic benchmarks that we can measure along the way to establish our element of progress. And then fourthly, recognize change has a fairly predictable pattern that can be followed, as illustrated by the graphic you see below, in terms of impact from negative to positive to time. And what we've done here is illustrated two curves. One has to do with managed change. The other is unmanaged change. And you'll see that in the long run, managed change moves to the process of getting better results, more positive, in a shorter period of time, and actually helps in reinforcing the idea that we can create an accelerated pace of change. So once you've established one good clinical guideline that works well, you will be able to accelerate the process as you go forward. And that's an important piece of this whole element. So once again, leaders create the context and need. They help to understand what that resistance is, working with staff to work through that resistance, establishing good benchmarks and predictable outcomes. So, what have we learned in terms of what we could apply for this particular practice that would help this particular physician and the nurse in having a productive dialogue so that the rest of the staff will work with them in implementing the process, thereby by creating buy-in? We're going to talk about 3 or 4 major elements. First, accept the idea that the regulatory authority is going to use the guideline to periodically evaluate our practice. In other words, we actually have no choice but to implement it. But we do have the choice on how we apply that to our particular setting. So that means that you do have an opportunity to influence how that plays out in your quality improvement model. Secondly, this is an opportunity to educate your staff regarding the clinical validity of the guideline. And the fact that it is valid comes from the standpoint that it's been established based in science, has predictable outcomes of value, both in terms of health gains and as well as costs, benefits. Third, you have an opportunity to challenge that nurse to take on a leadership role in implementing this particular overall process of implementation. By incorporating a specific statement of responsibility in her job description and her work plan for the year, you will help her to understand that this is something that you are expecting her to really do. Next, work with this nurse to develop and implement daily task lists or checkpoints to be used by the practice with patients with diabetes. In other words, these are the things that we always want to do. In other words, it's going to be a daily focus. It's not just going to be something that we think about periodically, but it's going to be daily. Next, hold periodic meetings, sometimes when people least expect it, to just spend some time chatting about what's going on well, what's not going on so well, and then brainstorm with the staff for new solutions. And these can be done not during just their QI meetings, but in any setting during the week. And then next, recognize the nurse for her accomplishments. This is a major change, and it's important that you identify the fact that she is doing valuable work. The staff are doing valuable work. And that leads to the next item, and that is be sure and celebrate successes. There's no better reinforcement that success breeds success. And then next is the element of encouraging self-directed work. And what we mean by that is step back and let the staff do their job, and you'll be amazed at how well they will do their work. Now let's turn in closing to some of what we've learned from studies on the implementation of practice guidelines. You're going to see some common themes. First, set time and resources aside to implement the initiative well. Second, recognize it takes time for staff to accept this new initiative and guideline. Third, make sure there are clear expectations. Fourth, you as a practice leader needs to be well engaged, not standing back, well engaged, so as to demonstrate how your leadership will create a positive environment for other quality improvement initiatives. Again, success breeds success. Ensure that there is proper emphasis on the importance and use of these measures. This will help reinforce this point of accelerating change over time. Next, don't underestimate the time required for staff, nurses, and other staff to implement these changes. You have to make sure that they have those times set aside. And then next, incorporate expected improvements associated with each PDSA cycle so that they can be evaluated. And then last, remember to consider the influence of factors such as fatigue, distraction, time pressures as this new guideline is being implemented. So you need to be flexible and understand that in order to move through this curve process to accelerating change, you're going to have to be thoughtful. And lastly, remember, You hold the potential for success in your hands. Be positive and committed.